Black doctor is important? Well, take a look at how this doctor observes two people with the same condition.
This looks fake, but it's a real condition called Marcus gun-jaw winking syndrome.
Pay attention to his eye as he's chewing. As you can see, with every time he chews, his eye opens. This is called Marcus gun-jaw winking syndrome.
It's clear just by his facial expression that he thinks that the black woman is faking this condition, whereas with the white patient, he's fascinated. And her content is about food. It's not even about her condition. She just happens to have this condition. But look at how a black Nigerian-American doctor approaches the exact same patient with this condition.
First of all, I love her attitude. As you can see, her left eyelid lifts every time she talks or eats. That's not editing, guys. That's real. What you're seeing is called Marcus gun-jaw winking syndrome. And no, I did not make that up. And yeah, she was born with it.
And this is why black doctors are important.
Would you trust these doctors with your life, considering their college admission standards are lower, and they might even have special classes to pad their grade to make sure they pass, only available to minorities? Now, that's not to say that
you saw a room full of black doctors and your first thought was to question their merit. No facts, just racism and vibes. Meanwhile, the actual literature and numbers suggest that every black person in America should be terrified of seeing a white doctor, especially pregnant black women. Take your glasses off, do a couple Googles, and you'll see that the origin of gynecology in this country was white men experimenting on black enslaved female women. Here's the title of my doctoral dissertation that I'm writing right now. When I see a room full of black doctors, I get happy as hell, because this means maybe, just maybe, we'll lose less black lives in the hospital.
When I was getting my teeth fixed, one of the dentists was telling one of the students, look now, you see this background out there in a white person, this discoloration, you start to look for a malignancy, but in a black person, that is normal. And you think about how many black people that have gone through a whole lot of surgery and everything, because somebody saw this bluish discoloration inside their mouth. That's normal. So we got to be dealing with people that know they're normal.
Do you know why it's important to have a black doctor if you're black? There was a patient I saw today. I got a consult. It's like, hey, you think this is frostbite? I was like, oh man, thinking that it's going to be dry gangrene, and if you don't know what that is, that means like your toes are basically going to fall off, and you need to put betadine and everything to make sure it stays dry until you can amputate it. I said, do they have, what's going on? Like, they're like, oh, it looks necrotic, it looks like blackened, it looks... I went to the patient, and the patient had hyperpigmentation. They told me it was necrotic. That patient had cap refill. Their toes were alive. They're just black. Yeah.
That right there is why we need more black doctors. This is why, as black people, we feel more comfortable and more at home with black doctors. They actually pay attention. They do the research. They care about our pain, the actual pain that we're in.
So today we are examining videos from original content creators who are, credits to them, who are saying they are more comfortable with black doctors because of the peculiarity of the black race and the black community and their uniqueness. Credit to the original content creator. The intention of this video is not to instigate racial hate or all that, but these are various individuals with various reports who are testifying and giving credence to them. They are saying they are comfortable, having a black medical practitioner examining them than a white person. They seem to do more thorough jobs with them than they would have a white doctor examine them. So if you're coming across my YouTube channel, please hit the subscription channel button. Please hit the notification button. If you're not a subscriber, please kindly comment and to share. They say sharing is caring. And so we'll be coming back to give our analysis, concluding analysis. So let's look at some more videos.
Watch this video and let's talk about it.
And if Mrs. Rosario has something about one of those...
It's Dr. Rosario. Thank you.
If Mrs. Rosario has something about...
Dr. Rosario.
Well, I'm sorry. Your name says on here, Carrie Rosario. Hey, Carrie.
It's Dr. Rosario.
If you got something
I would
specific
call you
about
Tony, so please, sir, call me as I would like to be called. That's how I'm
It
identified.
doesn't really matter. We're here
It matters to me. It matters to me. And out of respect, I would like you to call me by the name that I'm asking you to call me by. Thank you.
Your screen says Carrie Rosario.
I'm verbalizing my name is Dr. Carrie Rosario. And it really speaks very negatively of you as a commissioner to be disrespectful.
I'm Dr. Michael H. Ford, and let's talk about what you just saw. A black woman with a Doctor of Public Health degree introduced herself as Dr. Rosario. Former Greensboro zoning commissioner Tony Collins called her Mrs. She corrected him. He called her Carrie. She corrected him again 5 times. And then he said it doesn't really matter. As someone who holds a DRPH, I can tell you exactly how much it matters. A DRPH is not honorary, it is not easy, it is late night sacrifice weekends, years of coursework, a dissertation that nearly broke you, and a defense you prepared for like your life depended on it. I know because I have one. That title is not given, it is fought for. In 1864, Dr. Rebecca Lee Crumpler became the first black woman in America to earn a medical degree. One doctor sneered that the MD behind her name stood for nothing more than mule driver. In 2016, Dr. Tamika Cross identified herself as a physician during a Delta flight emergency. The flight attendant told her to put her hand down. A white male doctor offered to help. No one asked him for his credentials. 150 years apart, same message. Your title doesn't count. Dr. Rosario said it herself. As a black woman, she intentionally introduces herself as doctor because she's often dismissed in many different spaces. She logged into that virtual meeting with her armor fully on, composed, credentialed, professional, and a man in a position of public authority looked at her and said it doesn't really matter. Those 4 words carry the entire weight of American history on their back. Black women have earned every degree, every title, and every seat at every table they have ever occupied, twice over, under twice the scrutiny, with half the respect. Dr. Rosario didn't just correct a commissioner, she corrected centuries of history that told black women their credentials don't count. The city council unanimously removed Tony Collins the very next day. He wrote, and I quote, "There is no good excuse for my interaction with Dr. Rosario." She was always Dr. Rosario from the moment she logged on to that meeting to the moment he was removed, and she will be Dr. Rosario long after his name is forgotten.
Let me tell y'all why black doctors are so important. I've been sick for now going on 3 months, not knowing what's wrong with me. It started off as a common cold and then just progressed into me constantly having to cough, having eerie coughs. I can't breathe. I got to sleep with a humidifier. I'm coughing up phlegm, just all these crazy things. My doctor in DC moved to Bethesda. I didn't feel like driving out to go see her, so I went to go to GW's urgent care in the city. I went to the urgent care and the doctor barely talked to me. We were there for all of maybe 7 minutes. He barely listened to my chest breathe, just anything. He gave me an antibiotic. I took it for 5 days. Absolutely nothing worked. Then I'm like, let me just go to my doctor and let me just make this drive to Bethesda. I go out and see her today. She listened to my chest breathe for 5 minutes alone. She immediately says to me, "Baby, you got pneumonia." Now, while pneumonia may seem crazy, a black woman diagnosed me correctly. Happy Black History Month.
Happy Black History Month. There will be people who will try to tell you that the race of your doctor does not matter, and that's just simply not true. We have so much data that shows us that having a black doctor leads to increased trust, reduced healthcare disparities, even better health outcomes for some patients. I have a lot of anecdotal data that I've had from patients tell me how nice to have a black doctor who I feel like sees me for who I am, understands maybe some things that other doctors wouldn't understand, and it's just kind of an I see you, you see me kind of thing. Aside from anecdotal data, we're going to go straight to the facts. There's a study that shows that black newborns are twice as likely to survive when cared for by a black physician. It's not because one race is smarter than the other or etc. It's consistently in our history that we have lacked advocacy at times, and there's going to be a lot of years where we're going to have to make up for how people of color were treated wrongly in the healthcare system. There was a study done in 2019 that showed black men are significantly more likely to receive preventative healthcare, cholesterol checks, flu shots, any basic sort of labs when they are cared for by a black physician. And I think it's going to take years to undo the mistrust of the medical system. And I think some of that just comes from breaking down the barriers of feeling like you are seen and that there is someone who looks like you who is on the other side that you can trust. I've had patients who tell me they're like, I don't trust doctors, I don't trust the medical system. That's the whole reason why a lot of people deliver at home. But there are a lot of people who I think don't even realize that they have so much mistrust in the medical system. There's a study done in 2022 that by the AAMC that says that patients feel more understood and heard when doctors share their racial or ethnic background. the best example, and I don't know if everyone has felt this way, but like ever felt like you were somewhere maybe you didn't belong, where you looked around and nobody looked like you. Well, I've definitely felt that way in my life. I understand how people feel that way in the healthcare system. Specifically speaking from a maternal standpoint, Black educated women are 3 times more likely to die from pregnancy and birth-related complications than their non-Black counterparts. Because of years of systemic racism, when everyone comes into labor and delivery, we stratify their risk for a postpartum hemorrhage. You will hear us say that someone is at medium risk for having a postpartum hemorrhage because of their race, and not because they're more likely to bleed because they're Black, but it is because of provider bias to race. It's just what years of data have shown us, is that providers have a bias towards Black women that puts them at a higher risk for bleeding. The best doctors I know are Black. Some of the best doctors I know are white. There are excellent physicians all around, but representation in all races, in all fields, matters so much.
So welcome back. The discussion continues. I want to know what your thoughts, your opinions are in the comment section. Original credits to original content creators. You know, the distrust in the health center over the period where health workers have not really treated Black people properly has raised concerns and fears. And so studies that have been made, researches have been made, have been shown that people tend to be more open, more reliable with their people of their own skin color or race. It's like a psychological programming. And so that is why the Black community seem to be more comfortable with the Black doctors. But this is no disrespect to the white doctors or professions or their years of labor or hard work. I think it's just their own general opinion, and this opinion shared in this video does not entirely represent the entire opinion of the entire Black community, as some Black Americans are also comfortable with white doctors. So I want to know what your thoughts, your opinions are in the comment section. Please do due diligence by subscribing to this YouTube channel and encourage your brother. See you again as we bring up great and exciting content on the next video.